I'm very often asked by my patients and clients, what is it that causes spine pain? Well, I'd like to share with you the three main causes of spinal pain. Number one is a disease process. Now, this is a very serious condition, and there are many diseases that will affect your spine. Even cancer, for example, can infiltrate or metastasize into the spine. You can get infections in your spine. For example, tuberculosis can affect your spine. Now, these are very serious medical conditions and are the kind of things that aren't often found. However, your key factors to remember whenever you might be considering this is if a condition is not responding to the appropriate therapy. So, for example, if you've got pain and you visit your chiropractor or your physiotherapist, or even your medical doctor, and you're being treated for the particular condition that you present with, and it's not resolving, given the fact that the therapy should be appropriate for that condition, it's then time to look a little further. And by looking a little further, we might refer for an X-ray, we might refer for ultrasound examination, we might even refer for MRI scans to delineate and differentiate if there's anything much more serious underlying the pain that you might be experiencing. Now, these conditions, let me reassure you, are rare. They don't happen as often as the two of the following conditions that I will describe. So overall, I wouldn't be excessively worried about the fact that if you've had back pain, that you might be experiencing a disease of some sort. Of course, if you're concerned, the very first thing you do is consult with your healthcare practitioner and request an X-ray to at least start the process of a differential diagnosis. Now, number two condition is a little bit more common than the disease process, and it's referred to as a disc herniation. Now, as you might know, the disc is the shock absorber that sits between the two bodies of the vertebra. So if we have one vertebra above and one vertebra below, they are separated by a structure called a disc. Now, the disc, it's perhaps a little bit of a misnomer. It's not really a disc-shaped structure. It's more like a piece of lobster meat or crayfish meat, cooked lobster or crayfish meat. It's quite firm, it's quite rubbery, and it's not like a nice piece of cheese, a block of cheese that has been cut out. It's got little fronds that might appear in different areas, and it's quite hydrated. In other words, in a younger person, the disc has got a lot of water content which keeps the two vertebrae apart from each other. As we get a little bit older, that water content tends to reduce, and so the disc space narrows. In fact, the entire disc loses its hydration and tends to get narrower, bringing both bodies of the vertebra closer together. Now, under normal circumstances, that disc is held in place by very strong fibers that go around the disc. They're called annular fibers, and they protect the disc and prevent the disc from moving out of its space between the two vertebrae. However, you can do something. Sometimes it's an accident of some sort. Sometimes it's quite a minor thing, perhaps a cough or a sneeze. Maybe it's a trauma of some sort where you have a twisting motion, usually a twisting motion that affects the spine. That causes a tear in the back part of the vertebra that is holding the disc space, a tear in these annular fibers, and that allows the disc to what we refer to as herniate or bulge. Now, in layman's terms, this is often called a slipped disc. Now, the disc doesn't slip, it oozes. I love to use the analogy of a toothpaste tube. If you take the cap off the tube and you squeeze it a little bit, you'll get a little bit of toothpaste coming out. If you squeeze it very hard, you'll get a lot of toothpaste coming out. And not unlike the toothpaste, it's not possible to push the disc back into place, just like you can't push the toothpaste back into the tube. Once this disc has herniated or oozed, there is the potential that it can put pressure onto the little nerve root that exits off the spinal cord and exits between each of those vertebral bodies. You will then get referred pain, what's called to a nerve pain, neurological pain, and that means that that disc is impinged or trapped, entrapment we call it, and that will then cause a referred pain. And each level between your spinal vertebra will have a different distribution, and that's how we as clinicians can tell where approximately that disc herniation has occurred. It will depend on exactly where you are feeling the pain, the tingling, the pins and needles, or the weakness in the muscle. Now, that herniation is a little bit more common, but still not as common as the third condition. The third condition is what we refer to as mechanical spinal pain. That means the spine acts biomechanically between each of these vertebrae, right from the top of your neck all the way down to your tailbone. There are moving parts. We refer to them as joints. And those are the joints or links that allow you to bend and twist and move. And those joints, just like you can sprain an ankle, you can sprain the joint in your back in facets. So you can sprain the facet joint, it will get swollen, it will get inflamed, and that of course will trigger pain. Now that is the most common form of back trouble or neck trouble, and with that you do not get referred pain. You won't feel pain in legs or arms, you won't have tingling or pins and needles or any numb sensation, but you will have significant back pain or neck pain. So those are the three main conditions that will affect your spine. The disease process, that's handled medically. The disc conditions can be handled very adequately by a chiropractor, and he will be able to, or she will be able to make an appropriate diagnosis as to whether you should be referred immediately for a MRI, for a more definitive examination that we can see inside at the soft tissue, which is the disc, or perhaps an x-ray. But initially you might just be treated conservatively with chiropractic treatment, perhaps ice treatment, and some rest initially, just to allow some healing to take place. Chiropractors will very often handle quite adequately disc-related problems, but mechanical back pain is the chiropractor's domain, really. That's what we deal with all day long, whether it's coming from your neck or your lower back or between your shoulder blades. And those are the three main conditions that will cause any kind of spinal discomfort. I'm Dr. Kevin Lenton.